this gathering to celebrate World Cancer Day, and we thank all the stakeholders present here in showing solidarity in closing the care gap. We're here to start a series of conversations about universal healthcare and cancer, with special focus on blood cancers.
For this morning, we'll be talking about blood cancers and the role of primary healthcare in the management of blood cancers.
It is now time to listen to the perspective of a patient who has experienced living a life with blood cancer.
So I just had my CBC, and true enough, the blast cells were enormous. And that's the very sad day of my life.
I was diagnosed in 2017, multiple myeloma.
Of course, these are some of the gaps that were identified. Few specialists, we know that huge out-of-pocket expenses, for medicines, and sometimes they're not available, out of stock. And other treatments are very expensive, like bone marrow transplant, that's BMT.
We don't have enough cancer specialists.
A common foe, not just of patients but also of doctors, in terms of cancer care, but also disease and illness, is fear and anxiety.
I think the common theme that I heard here, two themes essentially. One, the patients need to be heard. There's a lot of things that as doctors we may not be aware of, and from having the Papo and patient advocacy groups speak out, then we realize what are the process that we need to fix in medical care.
Hindi naman porke magaling ka, okay ka na. Kailangan din ikaw mismo, andyan man ang cancer, pero yung mga araw-araw na gawain mo, nagagawa mo pa rin. Katulad po si sister, yung advocacies niya, nagagawa niya pa rin. So, andyan man si myeloma, pero kaya pa rin niya. I'm still functional. Kumbaga nga, I'm still human. Dito pa rin ako.
Might be an antidote for fear and anxiety in the face of illness, especially blood cancers, which is really our focus today. Number one, care and companionship.
But we all know that passing legislation is not enough. We need to push for implementation, and this is where civil society, such as Papo and the many patient groups under Papo, play a huge role in demanding accountability and social participation.
What is universal healthcare for you? I think it's the government's program.
So maybe universal healthcare also is really to give more information, empower the patients.
Under universal healthcare, nobody should be left behind. And then as identified, walang patient support group for multiple myeloma. So, taran! MyeSPEAK, which is the myeloma support for patient empowerment, access, and knowledge. Our mission is really to be the unifying voice, creating a strong and sustainable network of partners.
We in Healthway want to show the way. We want to lead so that others can either follow or compete against us, whatever. Kasi kailangan umangat yung cancer care sa Pilipinas.
So our organization is called the Dr. Rosita Gilio Primary Healthcare Hub. And if you take a look at the name of our organization, it's really about primary healthcare. And what that means is we want to empower two main kinds of people. Number one, primary care doctors, primary care physicians, who are really the first contact of a lot of our cancer patients, but also Filipino patients in general, and also our patients. So it's really putting healthcare in the hands of the people. And how do we do that? We do that through strengthening our primary healthcare system and empowering our patients and our doctors.
Happy World Cancer Day because we can beat cancer.
World Cancer Day! Close the care gap!